Hey everybody, and thanks for taking a few minutes to watch this video. What I'd like to accomplish here is to give you some background, give you some information about why this way of practicing medicine is maybe a little bit different than what you're used to. This is a unique program. We were the first in the country to partner with MDVIP in putting together this comprehensive women's health program that acts like a hybrid program where we take care of most of your primary care needs as well as your enhanced GYN care. What does that mean? Well, that means you can come to us basically for anything that you would normally see your primary care for or your GYN. We can look at the big picture. We can take that 10,000 foot view and really look at everything from a comprehensive approach. It's a one-stop shop in many ways. You know, Medicine 2.0, which is what I call what a lot of folks are practicing right now, is really based on putting out fires. Medicine really focuses on taking care of a problem when a problem arises, and that's important, and we do that in our practice also. But we also have a focus on prevention. We want to prevent that fire from ever occurring instead of just waiting till the problem arises. And this is a bit of a unique approach to healthcare. It's what I call Medicine 3.0. And to simplify it, it really approaches your healthcare in what I call the 4 Ps. And that basically starts with prediction. We use a lot of information in not only talking with you and spending time getting to know you as a person, but in our annual wellness visit, which is our big yearly visit where we do an extensive blood work, we do a lot of evaluations, that allows us to predict where your health trajectory may go because we're interested in extending your health span. That's how long you can stay vigorous and engaged in doing the things that bring you joy and happiness for as long as you can. We want you to live to 100, but we want you to be happy that you are. And one way of doing that is using our tools to predict where your risk factors are and then address those. And the second P is prevention. That's at the bedrock of our approach. In fact, MDVIP stands for value in prevention. That is the core belief of this way of approaching medicine is we want to do everything we can to assess risks, obviously take care of current problems, but more importantly, set you on a path, establish a trajectory forward so that whether you're 30, 40, 50, 60, 70, or beyond, we can help you achieve the best health now and importantly in the future. The third P is personalize. We're living in an era now where we have the capability of taking blood tests and other exams, other evaluations, and really drilling down and personalizing our care for you. And that's one of the keys to this MDVIP practice is we take you as an individual. We spend a lot of time talking to you about your needs, learning about what your goals and your aspirations are for your health. And that allows us to really personalize this program. It's not a one-size-fits-all program. It's a program that is really geared to your unique needs. And luckily, the way it's structured is we have the time and the expertise to be able to do that, to allow you the time that you deserve to provide the type of health care that you deserve. And the final P is participate. That means that we are your partners. You know, I work with a lot of people in menopause, and I jokingly say MD doesn't stand for menopause director. I'm there as your partner, and that applies to whether we're evaluating your risk for heart disease or cancers or stroke or dementia or just dealing with hormonal issues or dealing with issues related to women's health care. In all aspects of that, we ask you to partner with us to follow through with the actions that we recommend, and then we walk with you hand in hand down that path, do the assessments to make sure that what you're doing is achieving the goals that we have jointly put together. So that kind of characterizes in a bit of a nutshell how our practice may be a little different from what you're used to doing. Now, I don't deliver babies anymore. I stopped delivering babies. I practiced OBGYN for about 30 years and still practicing a lot of GYN. In fact, for the last several years, my focus has been on office GYN. And through those years, I spent a lot of time as a primary care physician for women. So we bring this combination of knowledge in applying it to both your primary care and your women's health care. In addition, I'm also board certified in bariatric medicine. That's weight management medicine. So I offer an extensive experience as well as training and expertise in working with the myriad of things that impact weight. And quite honestly, 70% of folks in our population today are overweight or obese. So it's a big part of your overall health and wellness. That's just another aspect that we bring to the table that is a part of the benefit and the value that we give you as an MDVIP member. We can address those specific concerns. We provide a plan of action. You think about a financial planner. You wouldn't leave your retirement and the financial benefits to be obtained at the end of your work career to randomness. You wouldn't just let that happen and hope that everything worked out, hoped that everything was able to accommodate you in retirement. You have a very specific plan. You've mapped it out step by step. Well, your health applies in the same way. Good health is intentional. It doesn't happen by accident. You need a plan, and you need someone with the expertise to be able to guide you through that plan and to not only help you give you the knowledge, but help you apply that plan and then assess the results, making sure that you're inching closer to that goal. And again, that goal is to extend not your lifespan, that's fine, but we want to extend your health span. We want you to be able to really enjoy the years, whether it's the next 10 years or the next 50 years. What makes our practice different? Well, there's a number of things. We have a very limited number of patients that we work with, and that's intentional because it allows us to give you the individual attention that oftentimes you don't get in a traditional volume-based practice. Our office is a very small office, and you can park at the front door. There's reserved parking. Literally, you walk a few feet to the front door, and then you come into our, what we call our no waiting room, because we run on time. How's that for a doctor's office? You have the ability to make same day, next day appointments, and you have my private cell phone where you can contact me after hours on weekends, text me anytime for any kind of emergencies. You know that I'm always there available to you to provide a level of care that I feel is outstanding. Now, the cornerstone of this program, as I mentioned, is our annual wellness exam. And that's a yearly exam where we do a series of 12 or 13 different screening tests, ranging everything from hearing test to vision to a vaginal sonogram where appropriate to an ankle brachial index, a multitude of physical exams and screening tests. In addition, an extensive blood panel that really assesses what your current health status is, but more importantly, identify risk factors that may not be felt, it may not be detected except by specifically looking at these particular issues. And that's another thing that we reevaluate literally every 6 months to see, are we cutting edge? Are we offering the things that are the best that can be offered to help you achieve your healthcare goals? Now, there's a yearly fee for our MDVIP practice, and that's $2,250 a year. And that covers all your annual wellness exam, all the blood work, all the personal benefits, all the concierge care that we give. And that literally breaks down to about $6 a day. I mean, heck, that's what it would cost to get you a mocha frappuccino at Starbucks. We feel like that return on investment more than outweighs the cost. In fact, if we kept you out of the emergency room once or twice during the year, you've paid for that fee. We also accept insurance, and insurance pays for any sick visits or visits outside of the annual wellness exam. So we still use Medicare and other private insurances to pay for those issues. This fee can be paid quarterly or semi-annually or annually. And many FSAs and HSAs, health savings accounts, medical savings accounts, may be used to pay for that annual membership fee. You'd have to check with your individual plan, but many will accommodate that. Over 90% of nationally of our MDVIP members re-up every year, and I think that illustrates the value that they see in being a part of this program. I mean, quite honestly, what is more important than wellness? Who cares about your bank account if you are ill and unable to enjoy the money that you have set aside? I can't tell you how firmly I believe that the value that you're going to get from this investment in you, in your health care, will come back to you more and more and more every single year. Now, if you want more information, you can simply call our office, call Tammy, and you'll actually mostly get a real person. And it's the same person. It'll be somebody who will know you and somebody who understands your needs and can meet those needs. You can call her at 706-842-4210. And, you know, if you're thinking about it, if you're just curious as to how we can meet your needs, if you want to really get specific about what we have to offer to you individually, feel free to call and set up a time for us just to talk one-on-one at no obligation, no cost, no fee, no obligation. I just would like to talk with you either on the phone or in person and be happy to hear about your needs and let you know how we potentially can meet those needs and provide the type of health care that I truly believe you deserve. Listen, thanks so much for watching this video. And I've actually put together another video with some frequently asked questions, which I believe is right below here. So feel free to view that. And please let us know if we can provide any additional information. And always remember, make healthy choices.